You know, one of the most common things I hear from patients is this idea that somehow if I just put enough filler in or do enough toxins, I can lift my face. They will always look at the jowl and say, I just want to put some volume up here to lift it up, especially if the problem is volume loss. When you establish the volume, reestablish the volume in the cheeks, you're going to get an illusion and or a lift of the jowls that gives an overall beautiful face. Many of us, or most of us, at some point in time have seen somebody who you look at them and you go, wow, that looks like too much volume. They've done too much. And that's probably because they're trying to achieve a lift. The truth is, facelifts, when they're needed, actually look much more natural than putting too much filler in. The combination of volume and lifting procedures when you need them is the perfect combination to have the most natural result that will last for the longest period of time. You know, one of the concerns patients have with facelifts is the idea of scars and maybe wanting to avoid scars. What I will tell you that I know for sure after having done 25 years of facelifts is the scars are never the issue. Scars melt away and fade away, but they are always present. The idea that a scar is not there at all after a facelift isn't true. We have to face the reality that there is a scar. Our job is to place the scar inside the ear and up behind the ear and into the hair so that it's as invisible as possible. And what I will tell you, facelift scars heal so well that they almost never are ever an issue. We're looking at volume, contours, lift, shape, symmetry, everything else, but the scars are always great. They're there, but they're very faded and very natural, and they're never a concern of a patient. One of the common myths is a facelift is permanent. The truth is a facelift is not permanent because aging marches on, and you're going to continue to lose collagen, lose volume, lose elastin in your skin, and all of those lead to some recurrent sagging, volume loss, and aging. So we tell patients that facelifts, on average, last 10 to 12 years. Some patients may want to do some lifting before the 10-year mark, but some last for 15 or 20 years. I did my mother's facelift 23 years ago when she was 55 years old, and we've never gone back and done a second one on her. And I think today she still looks better than she did before she ever had her facelift at age 55. So although she continued to age, we definitely set the clock backwards. That's what we expect out of facelifts. They're not permanent, but they surely last a long time, and they always make you look better long term than you would have looked had you not had the facelift. You know, the fact is, facelifts are not only for women. Facelifts are actually for men and women. And we do many, many male facelifts. Men are mostly concerned about the neck. They get a turkey neck, the sagging or the fullness in the neck, the jowls start to sag. That's what they're really worried about. Women more often are trying to get higher cheekbones and fullness as well as the jowls and neck. But men don't really want the volume in the upper cheeks. They really just want the lower face and the neck to be corrected. We do that through a small scar in the chin often, and then through very hidden scars around the ear. I even have done this facelift many, many, many times in patients, male patients who have almost no hair or are actually bald. And even with a bald patient, the scars heal so well that they're fully worth it, and patients really never complain about the scar. It's surprising, even with no hair to hide the scars in, men do extremely well. I love male facelifts. It makes a big change, and it really turns back the clock for them. You know, the truth about facelifts is there's many types of facelifts. We do CaloLifts, which are sort of a mini facelift. We do lower facelifts, full facelifts, upper facelifts, which we call brow lifts or endoscopic brow lifts. Sometimes we just make an incision in the neck and we'll actually do a neck lift isolated without doing a fuller facelift for that. So the scars sometimes are just in the neck, often the neck and the face, but sometimes just in the face and no scars in the neck. It is not a one size fits all. We really try to do a designer facelift that meets the requirements that you're looking for. We want to definitely make sure the facelift looks natural. That's our number one priority, and that it ages naturally over time. We don't want a wind tunnel look. We want a natural reshaped face. Patients would much prefer to have a little undercorrection and get a natural result than somehow looking like a dramatic facelift. That being said, we want to make sure the correction's complete and it looks beautiful and it's natural and it looks that way over a long time. That's our goals with the facelift.